And we are not live.
Okay, are we ready to begin then?
Hello? Hello?
Yes, we are.
Yes.
Am I getting through?
Yes.
This is Don Bailey.
Hi, Don.
Is this Laura?
It is. This is Laura Freed. Are you
Oh,
on
okay.
video? Do you want to start your video feed?
No, you see, I'm not on Zoom. I'm on just a call-in number.
Oh, okay. All right. Sounds good.
I must have confused everybody because I dialed all the numbers given to me and it never went through. So I somehow dialed them again and I got you.
Okay, great. I'm glad. Okay.
But I'm only going to be on a telephone.
Okay, that sounds good.
And
Okay.
I had given Wendy my cell number, so she has the number. So, but I'm on. I'm okay. you take me from there.
That sounds good. All right. It's a brave new world here at the PEB board. Okay, so it is 9:04 by my computer clock. So I will call ahead and call the meeting of the Public Employees Benefits Program to order. And I will call the roll, even though I can see most of you. I'm here. Don Bailey, you're here.
Here.
Linda Fox.
Here.
Marcia Urban is excused this morning. Leah Lamborn.
Here.
Jet Mitchell.
Here.
David Smith.
Here.
Tom Verducci.
Here.
Jennifer Krupp.
Good morning. I'm here.
Hi.
Hi.
Welcome to the PEB board.
Thank you so much.
It's-
I'm
this
excited
is-
to be here.
Yeah, this is a strange way. Thank you for your service. And when we get back to doing normal meetings in person, I feel like we're all going to be weirded out because this is the fourth, if I'm not mistaken, virtual meeting we've had. So we have a quorum, and I will now move to agenda item 2, public comment, and I will hand it over to Wendy.
Actually,
Madam Chair, this is actually Chuck's going to take over. So,
Chuck, will you do me a favor and announce it's public, the right number, please?
yeah, and I'm actually going to display it on the screen as well.
Okay.
So as the board members have stated, right now is public comment. And as you see on your screen, I'm going to go ahead and display the phone number for you to call in. There was a discrepancy on the agenda, I believe. The first digits of the phone number is actually 669. I'm going to go ahead and call off the last 3 digits of the phone number. When the number is announced, the line will be unmuted. You will hear an audible tone stating that your line is now unmuted, and then you may proceed with your testimony. And let me get the first one pulled up here. So the first number I have is ending in 920. Your line is unmuted. Last 3 numbers of 920, your line is unmuted. You can go ahead for your public testimony. Okay. The next number I have ending in 642. Your number is now unmuted. The next 42. Your number is now unmuted. The next 42. Your number is now unmuted. The next 42. Your number is now unmuted. Okay. The next number I have is ending in 4404. Your line is unmuted. Okay. Next number I have is 920. (688). You're now unmuted.
Just listening.
Okay. 837. Your line is now unmuted.
Hi, this is Kent Irvin. Can you hear me?
Yes, we can hear you.
Okay, good morning. This is Kent Irvin, ERVIN with the Nevada Faculty Alliance. Glad I was able to get in this way. Thank you all for your continued perseverance with remote operations and the budget cuts during these difficult times. I hope you're all staying safe and well. I would like to highlight one aspect of the Executive Officer's Report, Agenda Item 5. In January, the board asked the staff for various analyses on potential program changes, including an RFI on an independent actuarial review. While the COVID-19 budget situation has changed the calculus on some of those, it is our understanding that the RFI on the review, on the actuarial review, has already been finished. The board and the public deserve a full report on the results of the RFI, and the board request is still active. An actuarial review is a one-time expense that could offer solutions for operating PEB more efficiently. The cost is modest compared with the millions of dollars of excess unspent funds that have been generated nearly every year since the CDHP was implemented. Board members, please ask for a full report on the RFIs that have already been done for your examination and for the public at the next meeting. On Agenda Item 8, the contract solicitations, we fully support moving ahead with the request for proposals on the various contracts. It is really important to push the vendors to provide competitive bids. I encourage board members to actively participate on the evaluation committees on the major contracts. The PPO and HMO contracts in particular are essential to the operation of PEB, and they will influence plan design for years to come. Board members need to be involved in the evaluations of these contracts. Thank you very much.
The next one I have is 688. Your line is unmuted.
I'm just listening.
Thank you. Next line I have is 755. Your line is unmuted.
Yes, this is Marlene Lockhart with the Retired Public Employees of Nevada. I would like to associate my Kent Irvin's comments. We absolutely feel that the information obtained, cost, etc., from doing the RFI should be released and evaluated and considered by the board to move forward. Thank you.
837, your line is now muted.
That's Kent Urban. I don't know why I'm back on, but I don't have any further comments.
I apologize for that. 755, your line is now muted. Your line is unmuted for public testimony.
This is Marlene again.
Okay, I
I
apologize.
already
It looks
commented.
like we had somebody jump in out of order here, so it screwed up the jump. I'm sorry about that. And that looks like all numbers for public testimony, Madam Chair, have been addressed already.
Okay, thank you very much, Mr. Carroll. Let's move to agenda item number 3, PEB board disclosures for applicable board meeting agenda items. I will turn it over to Deputy Attorney General Mooneyhan.
Okay, sorry, I couldn't unmute for a second there. Thank you, Madam Chair. Just on behalf of the board members who are eligible for PEB benefits, which I believe is everybody except Mr. Verducci, I'm making this disclosure pursuant to NRS 281A.420, as the board members may vote on items that affect their benefits or benefits available to their family members. It appears all of the items on today's agenda have an indirect benefit, but I'm making the disclosure in an abundance of caution. And if any board member has something to add, I invite them to do so now. Thank you.
Okay. Agenda item 4, the consent agenda. If the board has reviewed the minutes from the last 3 meetings, please speak now if you have any corrections to offer to the staff. I myself have one for the minutes of the March 31st meeting. On action minute page 2, I believe Mr. Ramps from ASME's last name is misspelled, so I would ask for that to be corrected. Other than that, I didn't see anything else. And I'm not hearing or seeing anybody unmute, so I would accept a motion to approve.
Tom Verducci for the record, so moved.
With the correction.
With the correction on the spelling of the name, yes.
Okay, do I have a second?
Jet Mitchell, second.
Okay. All in favor? Shoot, maybe we should do this roll call, Laura, do you think? So we don't talk over each other. Okay, I will roll call. I vote aye. Mr. Bailey? Uh-oh. Okay, so what I'm gonna...
Okay, Madam Chair, I second that motion.
Well, we got a move for approval as corrected from Mr. Verducci, and we got a second from Ms. Mitchell. So I'm actually doing a roll call vote, because if I ask for everybody to say aye at once, I'm not sure we'd all hear it. So.
Aye.
Okay. Ms. Fox.
Aye.
Ms. Lamborn.
Aye.
Ms. Mitchell.
I seconded it, so yes.
Okay, yeah, I figured you were an aye. Mr. Smith.
Aye.
Mr. Verducci.
Aye.
Ms. Krupp.
Aye.
Okay, great. Motion carries. Okay, agenda item 5, the executive officer report. I'll turn it over to the executive officer.
All right. Good morning, everybody. For the record, Laura Rich, Executive Officer. This Executive Officer report that provides just an update on the overall activity tab. So the first thing we're going to talk about is Plan Year 21 open enrollment. As you know, open enrollment is underway. We're actually it's almost done. Ends in a few days at the end of May. So Plan Year 21 open enrollment under normal conditions. Typically, we have an all staff on deck type approach. We have everyone answering phones. Typically people, even our IT people, are answering phones during open enrollment because of the volume of calls that come in. Obviously, the circumstances this year have changed quite a bit, and we have a staff that is rotating in and out throughout the office. So we have many less people answering calls. We're trying to get members to, or encourage members to send emails instead of calling in order to get through. But I'm happy to report that we've been able to adapt to the conditions pretty well. And we're still able to service our members, give them that excellent customer service and support that we have been, or that they've been so used to getting. We just have had to put some accommodations in place in order to do that. So it's just a little bit different this year, but we're still able to, it's still been pretty smooth, and there's been no real big issues throughout open enrollment. So that is great. The Department of Labor guidance. So actually it was over a month ago, the Department of Labor recently, they released COVID-19 related regulatory guidance. And this guidance really loosened a lot of the participant and plan deadlines. So, for example, we have a lot of plan rules where you have to submit supporting documents within a certain amount of time. So for example, if you get married and you want to add your spouse, we need to have a marriage certificate. Because of the obvious delays in vital records and things like that, there's members that are having difficulty meeting these deadlines. And because of that, the Department of Labor recognized this and issued this guidance. Although that rule only applies to ERISA plans, it really strongly encourages plans like PEB to comply. So PEB has used this guidance as a roadmap, and we have also loosened up our rules a little bit too on a case-by-case basis. So for example, if a member is not able to obtain a marriage certificate in time, we've extended that deadline a little bit, just so that we can ensure that members are receiving the coverage that they need, and that these office closures, the state office and government office closures, are not affecting their ability to get coverage. So we have done that. The next one is just an update on the Unum long-term care product. If most of the board members remember, back in September, we talked about the Unum long-term care contract that PEB had. Back in the day, we transitioned to away from contracts with voluntary benefit providers, and instead we transitioned that onto the voluntary benefit platform that we have with Morneau Chappelle and CoreStream. And those relationships are now maintained through Morneau Chappelle and CoreStream rather than PEB. So the last contract we had was with Unum Long-Term Care, which was expiring on June 30th of this year. At the time, the board voted to not renew that contract and instead let that contract terminate. However, the decision was made that just like all of the other products, if they were able to transition onto that voluntary benefit platform and make that change, that we would continue to offer it through the voluntary benefit platform. As of a couple weeks ago, Aegis, the broker that represents Unum and CoreStream, they've been able to coordinate and are in the process of fully transitioning that product to the voluntary benefit platform. So I just wanted to update the board and let them know that although we have that contract is expiring, that product is going to continue to be offered through the voluntary benefit platform. So that's actually a benefit to members who have those long-term care policies, and they're going to be able to enroll, they're going to be able to have those voluntary benefit deductions through their payroll deductions as well for this product. So happy to report that. The budget enhancement options. So if you remember at the January 23rd board meeting, the board approved staff to perform additional analysis on several different requests that we had to be included in the budget that would be submitted in August. The intent was to bring this analysis back to the board so that we could discuss the budget submission at this board meeting. Unfortunately, things have changed quite a bit since January, and in that time, we've since had to make budget cuts versus budget enhancements. So I think, it's safe to say that these are no longer on the table. So, we did actually put out the RFIs. We have those RFI responses. I know that the actuarial review came up in public comment. We did get responses on that. I am happy to bring this back to the board meeting in July and talk about those responses if that is something that the board would like to do. We've done all the analysis. It was just a fruitless effort to discuss it given the situation that we're facing as far as the budget. So if that is something that the board would like us to do in July, we would be happy to bring that information back, including the responses to the RFI. In conclusion, I think we all know PEB is facing many, many challenges ahead, not just PEB, but the state. The uncertainty surrounding the economic impact of COVID-19 on the state and the rising cost of healthcare will likely force significant changes on the program. But we continue to work with leadership, and we will ensure that the program continues to meet the mission of providing employees, retirees, and their families with access to high quality benefits at affordable prices. The one thing that I did not include in this report, because we actually just wrapped it up yesterday, is our strategic planning. We did have our annual strategic planning session over the last 2 days. And I don't know if maybe Chair Freed would like to say a couple words and maybe recap a little bit of that strategic planning.
Yeah, I would be happy to. We did, 4 of the board members did meet with PEB executive team and a couple of the events and talked through some program ideas about how we might structure the benefit offering for the next biennium. So to Executive Officer Rich's question about do we want to bring that back to the board in July? Yes, please, on my part. And I think Aon did a nice job developing some program offerings that might please the participant group while still making the cuts in subsidy revenue that I think we expect to see. And to be who have no idea at this point what the reduction target might be. The GFO has not given PEB any idea of that yet. So really it was about program, not necessarily about fiscal, but you kind of can't divorce those two things. So the discussions had that, underlying, worry about, okay, how can we offer something that is lean, but still makes participants feel like they're getting something pretty good from the plan. I don't know if any of the other board members want to chime in. As I told Laura last evening, I learned some things I didn't know. So thank you to Aon, and thank you to HealthScope, and thank you to Hometown, who gave us a little bit of historical context about some of the stuff that's happened with the plan over the years. So that's my 2 cents. Mr. Bailey, I see that you have unmuted yourself. Would you like to ask a question?
On what? What would the question? I'm sorry, I'm misunderstanding you. Are you there?
Yes, I see that you've unmuted yourself. I wondered if you had a comment or a question.
No, I didn't. I didn't touch the phone. I think they cut me off.
Okay.
But no,
okay.
I do not have a question, Madam Chair.
All right. So with that, shall we move on to agenda item 6, presentation on the impact of COVID-19 on the plan?
That's me. So let me try to share my screen.
All right. Okay.
You can hear me, so that's good. Let's see. And I'm just going to bring it up from the website, so hopefully you're all able to see that. Does that work? Did it show up for y'all? Perfect. Okay. So I hate having to put all these disclaimers on it, but as you might imagine, we're all in a very fluid situation. Not only are the reported numbers changing, rates of infection, then the numbers that are being reported get corrected because they've combined antibody testing with infection rates. States are also making new announcements by the day in terms of their reopening strategies. So for example, I submitted this presentation to PEB, I believe it was last Wednesday or Thursday, and since then your governor has announced additional reopening actions that you all will be taking. So those were not incorporated into this presentation, but I still hope you'll find some value in it, just and maybe some additional knowledge bases that you didn't have before. So let's just move on to the second slide. Again, I hated to put all these disclaimers on it, but it is such a fluid situation. I felt like it was important. Okay. So Aon has put together a model, and we actually released this model, and it's called the Employee Impact Model, released at the beginning of April. And what it's doing is it's tying to about over half a dozen different epidemiological, I'm always happy when I say that correctly, sources, as well as other like Johns Hopkins and other, I guess, industry groups that are reporting on different metrics throughout the nation. So sometimes, you know, those sources are reporting the same things. Sometimes they're reporting different things. So the model is really trying to triangulate the best sources of data and take all of that into account as it's trying to estimate for different employer groups, what could the potential infection rates be for your population over time? How might that change as different employers go back to work? We also have had different employer groups who have been working, let's say hospital systems throughout this entire pandemic have not been able to work at home. We also have tech companies, right, who are able to pretty easily work at home. For PEP's population, what we've modeled is that about 64% of your employees had to report to the workplace. It's kind of our best guess based on your blend of industry. Certainly, if we went person by person, we may find that PEB actually, of the people that it covers, had 75% of employees who had to report to the workplace. As you might imagine, again, a lot of models depend on the inputs that it's given. And I just wanted to let you know that we did a 64% industry estimate in terms of that particular dynamic. What it does is it takes PEB census data, it looks at your zip codes, it looks at the infection rates by zip code. It also looks at your self-funded group versus your fully insured group, and it's able to filter on all of those different metrics. And we'll move on to just a snapshot from the model. Thought that would be easier than trying to pull up the model live. So what the model currently does is it takes today's information and tries to, again, project all of that forward. And right now the model has an end date of September 30th. I think we all recognize this COVID-19 is not going away on September 30th, but the model is really intended to help employers try to figure out how much risk do they have, how much potential lost days of work, for example, might their workforce be experiencing over the next 6 months? How do they safely return folks to work? How many folks may be in the hospital? Unfortunately, how many folks in their membership population may pass away as a result from COVID-19 illnesses? So it's taking into account a bunch of different factors and just trying to give employers, again, a good feel for what might happen and how they might be able to control those infection rates by different measures that they're taking either in the workforce or within the state. So clearly with PEB is very much tied to the state of Nevada and what they're doing. So this first sample from the model was assuming that Nevada maintained the safer at home policy that you all were in, I would say at the beginning of May, where there was a partial business reopening, right? But it wasn't full to the restaurants and certainly wasn't the casinos and to those other places of larger gatherings where, again, infection rates could possibly go up. It's also assuming everyone follows not only social distancing, but doing everything the CDC is recommending in terms of face masks and all those things. So as you might imagine, these numbers, again, can change by the day or even by the week. As we're moving those things around, people's infection rates change and how well people are actually doing in terms of following the guidance. So to orient you to this page, here is just a heat map in terms of where PEB's population is, no surprise. All of your folks, or the majority, are in Nevada. You do have a few folks from your pre-65 group that are located in other states throughout the country. Here it's showing what the model estimated was your peak infection date, which was April 19th. So it happened over a month ago, and how the plan would continue to see infection rates, again, through that end date of September 30th. At the bottom, it's showing your member count by 4 different buckets, excuse me. The first is just folks that are susceptible. So that could be people that were asymptomatic, never got a test. It could be those folks that were never infected, as well as those folks who maybe got a test but didn't test positive. The next group are those that tested positive. By the end of September 30th, it's estimating of your 47,000 members, and again, this is on a member basis, not just an employee count, about 1,400 would likely have been infected with COVID-19 throughout that 6-month period, costing the plan on average about $0 to $2,000 for these cases. It probably means they went to the doctor to get tested. Possibly they went to a center that cost more. Maybe they showed up at the ER, but then were later released, et cetera. They did not need to be hospitalized. So all of those cases kind of fall into this bucket. And then again, it's also trying to say, how many work days might you have lost from those folks, either from being sick, like I was in early April, right? It took me a few weeks to get back to work at full capacity. It's estimating an impact about 9,400 work days for those group. The next one over is kind of in the orange section is your hospitalized and or critical cases. So this model is currently estimating that you would have had about 100 folks that were infected. They would still be actively infected by September 30th. 99 would have recovered. On average, we're seeing these patients cost between $30,000 and $80,000 So it's a total of $3.6 million of claims costs that they're incurring. And less days lost, but more days per person, as you might imagine, for this particular group as they're facing hospitalization. The best estimate of the model, and it's not something that's pleasant to talk about, is it's possible that you would lose 10 members due to COVID. More likely, those tend to be the elderly or those with the comorbidities. But again, we are seeing a little bit of a fatality rate, obviously, with COVID, and that's the model's best estimate of your self-funded impact at this time. All that to say, when you sum up all of that information, it's expecting in the medium scenario, and we'll get to that in just a bit, that PEB's claims cost through September could potentially be $4.9 million. And that's, again, assuming that you guys are staying in a safer at home partial business reopen strategy that we all know you are not, especially not as of the announcement made on Tuesday. Any questions before I move on to the next grid? Okay, feel free to interrupt me at any time. So this next grid kind of shows all the different metrics that are in play, and it's probably not all, I probably shouldn't use that term. So the majority of the metrics that are in play. So the top part is trying to say if PEB falls into claim costs on the higher end of the spectrum, that's highlighted in the high column and also highlighted in the color orange, because that means it's more cost to PEB. Likewise, there's a low scenario which costs less, and then the medium scenario is self-explanatory. On the bottom, or not the bottom, the left side as you go down, it goes from actually being a high cost in the orange bucket, which is called low, right? Because it means you've had a low claim suppression. So what we are seeing is a lot of folks not going and getting those elective procedures done. You were not able to go into the doctor's office and get those things because they were trying to save PPE. So if PEB ended up in being in the low claim suppression bucket, that means there was not a lot of claims being avoided. So that's why it's highlighted in orange. There was less claims being taken out in that particular scenario, which is the negative 4.7 that carries across that row. The next one down is the medium claim suppression. So in a medium scenario, we would expect that PEB likely saved $7.7 million of claims that did not incur in those 6 months between March 1st and September 30th. And then likewise, there's a high scenario within the model. Again, it's projecting ranges that says up to $11 million of claims were suppressed. And when we're saying claim suppression, some of those will possibly be returning after a lockdown, but only 50% of them are likely to return within the next 6 months. And that information is based on a lot of interviews that we've done with the national carriers and what experiences that they have had over the years with, let's say, large natural disaster type of events like Hurricane Sandy or Katrina. It's a similar type of mass event where people are not going to the doctor for normal things. So it's kind of our best estimate of recent, natural phenomenon occurring and what impact does that have on folks' behavior. So that's where that 50% assumption is coming from. These costs are based on PEB's March 31st reprojections for claim costs in terms of a PEPM basis. And so our best estimate of the medium impact scenario by quarter, and I apologize that this rectangle got shifted when we created the PDF, is that in this scenario, if PEB again were to stay at home, it probably would be a savings actually to PEB's plan through September of $3 million. Questions here? Okay, the next scenario is trying to get closer to what we think will actually potentially happen with Nevada. So what I was doing here was there's different points in the model where I can flip the different phases of reopening. So I had taken a stab at guessing that you might have gone to a next level phase 2 of your reopening strategy on June 1st, and then went to a broader, more open strategy on July 1st. July 1st basically was an assumption that people are still doing social distancing, and there's a little bit of capacity reductions at, say, restaurants, but for the most part, everyone's kind of back in the office, back at work. But because of all of that opening and the rate of infection that we've seen historically with COVID, It was creating a peak infection rate happening in PEB's plan and its membership on August 3rd. And seeing these cases rise, then the estimate was that the governor may put Nevada back into a stay-at-home or shelter-in-place policy. Certainly, I have no insights on that. I'm not predicting what the governor may do, but the model is simply trying to take into account what may logically happen should we see a spike in cases. And so I moved you all into a shelter-at-home status starting on September 1st. And so that's where the claims and the infection rate started going down on this graph. And the nice thing about the model is you can put it into different stages of reopening and see how that impacts the membership over time. So it's been a good tool for some folks to try to, again, try to help them figure out, you know, how much of their workforce should they be trying to move back into the workplace versus continuing to shelter at home where possible. So here is the same boxes that we went through before. And you will notice, obviously, there's more people infected. There's more people being hospitalized. Unfortunately, there's also more people who have a fatal result of COVID, as well as the total medical claims cost in this scenario could be upwards of $16 million. This does not take into account any of that claim suppression. We'll see that on the next slide. But here's kind of the stratification and how, based on what we know today with infection rates and things being opened, how that might impact. Obviously, as we've now had some states that have been in a more open situation now for about 3 weeks, this data in the model, because it's linking to direct data sources, it does update by the day. So I could run this model today. This is last week's information, and you might be getting a different number here. We've seen it move up and we've seen it move down. So I just want to also make that disclaimer. Any questions on this model versus the other one? And then not to be the bearer of bad news, but here is that same grid that we looked at before with the different claim cost scenarios, the different levels of claim suppression. So here it could potentially be a $20 million impact to PEB if there's low claim suppression, but high claims cost, high rates of incidence and infections that cause PEB membership to become hospitalized, versus you still could potentially see a $3 million savings, even with all of the reopening. Again, just depending on how much claim suppression PEB has seen or will see through the end of September. And all of the disclaimers and limitations that you can fit onto one slide here. Again, we still don't know, you know, how much reduction we're really seeing in these non-critical medical services. We are getting your weekly invoices from HealthScope Benefits. They're seeing a little bit of a decrease coming through, but you all do have a very long lag in terms of claims payments. So some of my other clients have seen a more immediate impact in terms of their claims invoices really dropping in terms of the volume of medical claims that are being processed from being incurred in, say, April. Your all claims do take a little bit longer to process. So maybe hopefully in June, you might start to see some of that you've actually seen more suppression than currently is being reflected in those invoices. And then the other things, of course, to take into account is if any new drugs or vaccinations are developed for treatments, as well as, again, the really big piece of all this, of course, is how we all act when we're out in public and how many of us are out there, hopefully not infecting each other. Questions?
Yes, Madam Chair, Tom Verducci for the record. This is for Stephanie. You know, at this point, we don't have any guidance in terms of federal disaster relief, but at what point do we look at going into catastrophic reserves? Is there any trigger or indication if this does get out of hand and starts weighing very heavily on the plan? At what point do we start looking into that?
I think we would need to work with Carrie and Laura Rich in terms of the cash that they have available to pay the claims. So let's say when things reset for their plan year in July, you know, you might not see those larger claims coming through until, say, September, especially if things open up and those claims are being incurred in July. I would expect it might even be into October when you start to see that. And then we might be able to know from there, or potentially, let's say, a November board meeting, how things are looking I think the majority of it may have to happen closer to when we're trying to set rates and know how the prior year's plan ran before we're trying to underwrite the next year, because that's usually when a claims shortfall or a claims windfall, if you will, for lack of a better term, kind of cycles through the underwriting, right? And gets caught up for the next years. But certainly I know, based on what Carrie has told us in prior meetings, is that, like, for example, the retire regroup and the Reggie is seeing higher claims than what is coming in the door. So just from a financial perspective, you know, she's running a shortfall in that bucket now. I think you may see the same thing should COVID claims really take off for you all in the next plan year. We may be in a situation like that where they need to tap into those CAT reserves in order just to have the cash to pay the claims. And Carrie or Laura, I hope you can correct me if I'm misstated anything there.
This is Laura Rich for the record. No, you're right, Stephanie. And I just want to add that we do have, as of, was it last week, I think? Yeah, last Friday, we have about a little over $1 million worth of claims, COVID-related claims. Some of those are pending, obviously, some of them are paid, but we're over that $1 million mark now.
This is Laura Freed. Can you cut out a bit? Can you restate paid claims versus claims that are still with the TPA? Billed charges, I guess.
Yeah, and for the record, Laura Rich, I don't have that right in front of me, but I know that the paid claims are somewhere in the high 100s, whereas the pending claims are somewhere in the high 800,000s.
Got it. Thank you.
Do we know that, it's Tom Verducci for the record, do we know the number of members that have been tested positive with COVID? You may have covered this. And is there any trend that we're seeing? And have we had any members that have deceased from COVID at this point?
For the record, Laura Rich, we don't get the results, obviously. That is, we don't get HIPAA, that type of HIPAA information on a plan level. But I can tell you, yes, we have had, that I know of, at least one member who has passed away from COVID-19 related illness.
It's very sad. Thank you very much.
Board members, do you have any other questions or comments? Okay. With that, then, I guess we'll go to item 7, update on the Morna Sheppel Performance Improvement Plan.
Good morning. This is David Basson from Morna Sheppel. Can everyone see and hear me okay? Excellent. Laura, I see you nodding. Thank you very much. So good morning, everyone. For the record, my name is David Basson, spelled B-A-S-S-I-N, and I'm representing Morna Sheppel for this agenda item. My role at Morna Sheppel is to oversee our administration solutions operations. I presented to the board in July of 2018, and it's a pleasure to be back in front of you again, albeit virtually, to speak to you again and present our progress report on the Performance Improvement Plan. Our last update to the board was in January, and since then we have made excellent progress on our plan, to the point where, in discussion with PEB, we have agreed that the PIP is successfully closed. Sorry, the PIP is a Performance Improvement Plan, it's an acronym, outside of areas where we agreed to monitor and measure around open enrollment, which, as you know, is in process as we speak. While the full update is in the board materials, I'd like to speak to a few key areas. The items pending from our last presentation, which was in January, such as event processing rules, configuration, project management, quality assurance, and requirements management deliverables were all attained and closed with PEB's sign-off. We have closed approximately 98% of the internal service ticket backlog and 97% of the service tickets originating from PEB staff, both material improvements on what was reported at the end of January. The employer portal, which allows agency representatives to report changes in real time, has been successfully rolled out. We invested to improve the experience in how PEB members enroll in voluntary benefits, and to date, even given the current situation, the statistics are very positive. As of yesterday, 46% of members who visited the PEB's benefits site have enrolled in at least one voluntary benefit. To date, this represents a 20% increase to members enrolled in voluntary benefits before open enrollment began. I'm sure you'll agree that's very positive. As stating in the meeting materials and in the meeting earlier today, open enrollment has been successful to date, with no major problems reported by members, and the upgrades and system corrections are working as anticipated. In closing, outside of items that require monitoring during open enrollment, we have successfully executed on our plan. Given my involvement in these enhancements since 2018, I thought it would be fitting to come in front of the board, and I wanted to take a moment to speak to our relationship with PEB. As noted in the board materials, PEB has been a valued client and partner to Morneau Shepell since 2006. We have worked with PEB over the years, and we have been proud to support the state and its members. In 2008, we were presented with a challenge: improve our system and lower our costs to PEB and its members. Since then, as stated in the meeting materials, we have improved the member enrollment experience, introduced a suite of new benefits for PEB members, and helped PEB eliminate manual processes. This was all done at no cost to PEB, and late last year, we reduced our fees to PEB, effective for the remainder of the contract term. The agreement we made in 2018 to support this plan was to extend our contract for 2 years so we could continue proudly serving PEB until the end of 2023, and hopefully for much longer. Early this morning, we learned of PEB's recommendation to cancel this 2-year amendment extension, which is tabled in the next agenda item. We believe there are a lot of good reasons why the extension should not be canceled, and that this decision may not be in the best interests of PEB and its membership. Morneau Shepell is requesting that the decision to cancel the contract extension be delayed so that we can work with PEB and the board to present our case. Given the length of the relationship and the successful execution of this plan, I hope PEB and the board take this request under consideration. With that, I want to thank PEB and the members of the board for the time to provide our update, and I'd be happy to answer any questions anyone has.
Board members, any questions of either PEB staff or Morneau?
Yes, Tom Verducci for the record. I wanted to direct this question towards Laura Rich. I know at one of the last board meetings, there was a lot of issues with the amount of paperwork and mistakes that were happening. And Laura, has there been any noticeable improvement on your end? What has the experience been?
For the record, Laura Rich. Yes, so I'd like to, let me just go back to, yes, last year, last open enrollment leading up to the rollout of the voluntary benefits platform. There were definitely a lot of challenges. We had issues on the member side, we had issues on the staff side, and we've spent the last year working with Morneau Shepell to resolve those issues and really enhance the system to where we thought it should be. And to Morneau Chappelle's credit, you'll hear in this next report to Morneau Chappelle's credit, they have resolved a lot of the issues. Every once in a while, we still find ourselves, with having to resolve some issues on the back end. It's usually staff administrative side problems. But as far as the member side, yes, there have been, all of the issues have been resolved. We have successfully rolled out and smoothly rolled out the enhancements. This open enrollment, it has gone relatively smoothly.
This is Laura Freed. I would ask Executive Officer Rich to estimate the amount of staff hours spent fixing things on the back end, just in a given pay period, for example.
So for the record, Laura Rich, are you asking me to include last open enrollment? Because that number goes up dramatically.
Let's say in the last 6 months. Maybe you can do it on a monthly basis. I'm just looking for an estimate of PEB staff time that would not otherwise have been expended on this.
It's difficult to estimate. I would say the operations officer spends a good 50% of their working time on issues like this. I would say when I was the operations officer, I spent a lot of time on this. Nick, I don't know if you would like to chime in and talk about, what your estimated hours have been, because I know even though he's just been appointed the operations officer, he hasn't been in that role for very long. He really stepped in while I was the interim. So I think that he can speak to this as far as what's been going on in the last 5-6 months.
Yeah, so this is Nick Proper, operations officer at PEB for the record. It really goes in phases, but if I was going to say an amount of extra staff hours for the last 6 months, it's probably a good 5 to 10 extra staff hours per pay period.
Okay, thank you. I have another question. What is, if PEB staff could describe what kind of feedback they've gotten from agencies in automating plan election changes in open enrollment, or even outside the open enrollment from qualifying events. Has this been easier on agency HR contacts that need to make health insurance changes?
For the record, Laura Rich, I think what you're referring to is the employer portal that we rolled out.
Yeah. Okay. Thank you.
So we replaced the old paper system with an employer portal instead of agencies having to get their hands on a barcoded form and submit it to PEB via snail mail, because we have to have the original copy, and then things get lost, things don't make it, and so things happen. The new system has been, I'll have to say, it took a lot of time to get it to the point where we could roll it out, but it has been a benefit, a very good benefit, because we have been able to we've been able to automate a lot more. And so I believe that agencies like this, as with any new system, there's a learning curve. Some of these HR representatives from different agencies have struggled a little bit with it, but that's to be expected. There's that learning curve, but I think overall it's been beneficial.
Anyone else with questions before we move on? Okay, then let's move on to agenda item number 8. Discussion and possible action of contract solicitation report. Take it away, PEB staff.
All right, for the record, Laura Rich. The contract solicitation report is intended to provide information on current PEB contracts that are expiring within the next year so that we can address future procurements as a result. There's a lengthy solicitation process that is required on some of these. And on top of that, we have also we have to accommodate that implementation time that is necessary. So we have a long runway for a lot of these contracts. So we have to look at them well ahead of time and start addressing them literally at least a year in advance. So the general policy of the state of Nevada is to solicit requests for proposals or RFPs every 4 years.
Laura, Jeff, for the record, you broke up when you said there's a lengthy, I wanted to capture what you were saying with that overview. So you broke up. I apologize. I wanted to have you repeat what you said earlier about lengthy something. Thanks.
No problem. So there's a lengthy solicitation process. So first you've got to go through that RFP process, which is already lengthy to begin with, but then you also have to accommodate the implementation time necessary too. So we have a long runway that's necessary. You have to address all these expiring contracts well before they expire. So the general policy of the state of Nevada is to request these RFPs every 4 years. So you typically would go out to bid every 4 years. I am going to say, though, there's a disclaimer to that. PEB doesn't necessarily adhere to that 4-year rule because there's so much disruption, especially when it comes to, for example, our PPO network, right? Do we really want that for 4 years? Because what happens is you establish a network and then those members then establish medical providers and relationships with their providers. And then 4 years later, we switch it all up, right? So you want to take those types of things into account. But typically the general rule is that we go out to RFP every 4 years. Most of these contracts have not been solicited in quite a while, as you'll see. So PEB believes that in most of these situations, in all of them that we're presenting today, that an RFP is the best way to move forward with these contracts so that we can adhere to this as well. The other thing I'm going to add to this, and it's not in the report, but I wanted to make sure that the board is aware. As the board has heard before, we've been under an LCD audit for the last year, and we do not have those formal findings yet. We have not been given anything by the LCD to say, here are your formal findings. And even if we had been given that, they're confidential until they are presented to the legislative subcommittee. However, what I do want to say is that through the course of the last year, I feel like, and I believe there's an expectation that PEB's liberal use of contract extensions is going to be highlighted. And so I believe because of what I think is coming down the pike, it's probably best that we stay away from contract extensions and we look to RFP some of these contracts that are expiring because of that. So that's just something that I wanted to put out there. We don't have the formal findings. I don't have anything from the auditors, any formal kind of report from the auditors, but this is just my general feeling that the contracts are based on the conversations we've had and the questions that have been asked. Those contract extensions will definitely be something that comes in those findings, I believe. So you'll see that table. There is 5 contracts that are expiring that we need to look at today. The first one, as you heard, is you heard from David Basson from Warner Chappell, is the Enrollment and Eligibility Benefits Management System. So to give you a little bit of background, I think a lot of the board members that are on the board today were around back when this happened, but just for a little bit of background. So PEB contracted originally with Warner Chappell back in 2006. And we went out again to RFP in 2013, and Warner Chappell was then again selected as the winning vendor. The current contract began in 2015 and is set to expire in December or on December 31st of 2021. However, back in November of 2018, a contract extension through an amendment for an extension through 2023 was approved. However, it included various vendor requirements and the ability for PEB to cancel the extension should Warner Chappell not meet its obligations outlined in that contract. As we've already discussed, the last open enrollment was really, really challenging. And Warner Chappell did publicly acknowledge that it failed to meet those identified benchmarks in the contract. And as a result, they had been required to present a performance improvement plan to the board. The decision at the time was that the board would revisit this contract amendment and the extension after plan year 21 open enrollment to decide whether or not PEB should cancel the amendment or honor it through 2023. So we're faced in a situation where if we cancel the amendment, then we go back to the 2021 the 2021 termination date. If we continue to honor that amendment, then that contract won't expire until 23. As you heard, Warner Chappell has spent the last year making improvements to the system. I've already given you an update on that. It's gone pretty smoothly. They've managed to rectify the situation in the last year. Despite this, PEB believes that it is in the best interest of the program to cancel the amendment and the extension as a result and proceed with a solicitation. There's a couple of reasons for this. First of all, the contract has been in place since 2013, we haven't gone out to bid since 2013. So this is well beyond the 4-year recommendation. This is also one of those contracts where we probably wouldn't do a 4-year just because of the heavy lift and cost that comes with a new implementation. And so you probably don't want to do this every 4 years. It would be very costly on the program, and it would also be very disruptive to members as well. So this is probably one of those that we don't want to do every 4 years, but we're looking at it's probably good to go ahead and RFP because it has been a while since we've done that. Additionally, PEB could be potentially setting a bad precedent by honoring a contract amendment where the terms of the agreement were clearly not met by the vendor. So that's another concern of mine, on top of the LCB contract extensions or the audit and the concern with those contract extensions. So at the January 2020 board meeting, PEB recommended and the board approved proceeding with a request for information for a replacement eligibility and enrollment system. And the reason we did this was just in case, right? If we were to be put in a situation where we were going to go out to RFP, we needed to have that information available. So PEB did receive 8 responses with estimated pricing based on the criteria outlined in that RFI. And the estimated pricing for all the proposals included higher per member per month fees than what PEB is currently paying today. That was expected. But many of the responses also address the ability to develop alternative and creative solutions, which could drive down the PMPM fees or reduce the implementation cost. So you'll see that a draft overview and scope of work for this RFP is at the end of this this document or the report. I do want to say that the proposed timeline, there's probably going to be some changes to that proposed timeline. There's going to be, we need to extend that implementation time and things like that. So that will probably need to be changed a bit. So I'm going to stop right there for questions on this one before I continue.
Okay, board members, comments, questions, clarifications?
Madam Chair.
Mr. Bailey, go ahead.
I have a question, Laura. In the last year, I guess the vendor has cooperated and actually shows improvement. Is that correct?
That is correct, Mr. Bailey.
Okay, now, if we go to an RFP, probably that is needed, I think, because of the long term. You know, I go back and I look at these documents, and the expiration dates are all 2021. But if we adhere to that 4-year policy, which we have not, I know a number of our member groups have actually complained about the extension program. They would like to see it, in many cases, with RFPs, because they think it's a better deal that the state of Nevada could get in negotiations. If we go with an RFP with this vendor, we would actually, your organization would be in the position to negotiate some better terms. Would I be correct?
Correct. You know, we don't know what kind of responses we'll get from the RFP. There's certainly some things that we can put into the RFP. As I said, we can put in there, you know, any alternative or creative solutions that these vendors could come up with to drive down those PMPM or implementation costs. So there's always, you can leave it kind of open-ended so that we have a little bit more room to negotiate, not just the services, but also the pricing as well. So we don't know what's going to come back. The pricing and the cost proposals may be higher than what we're paying today. They may be lower. We don't know what's going to come out of that, but that's the purpose of an RFP.
Okay, that is correct. I understand. Yeah, we've been on board with this vendor for what, 2006, I believe.
Correct, since 2006.
Okay, and we made extensions. So, well, Madam Chair, I won't ask any more questions, but I'm sort of leaning to an RFP because I think it's due 1 year of improvement with all the problems that our staff has had with this vendor. I'm not sure a 1 year improvement is enough that we should take a look and do another RFP. So I'll withdraw right now and I'll let the board ask some more questions. Thank you.
Okay, thank you, Mr. Bailey. I would tend to agree with those comments. I would remind the board that the state administrative manual tells us that it is the general policy of the Board of Examiners that contracts be solicited at least every 4 years. So the fact that all 5 of these contracts are well over 4 years old causes me some consternation. And you've correctly pointed out that, you know, and Laura has correctly pointed out, this one's been for 7 years. I think we want to get away from that. But I will let the executive officer go through the PPO network, dental network, financial auditor, and the HMO discussions if she wishes.
Okay, so for the record, Laura Rich. The next one is the in-state PPO and EPO network. So PEB contracted with Hometown Health for the in-state PPO and then later on the EPO network services initially on July 1st of 2010, and it was again selected as a winning vendor in 2013. So the current contract began on July 1st of 2014 and then was extended in 2017. So it's now set to expire on June 30th of 21. So although the contract is between PEB and Hometown Health directly, Hometown Health in their RFP submission included a joint proposal between Hometown Health and Sierra Healthcare Options, or otherwise known as SHOW. The partnership creates this comprehensive statewide network that allows PEB to maximize their provider contracts throughout the state rather than having to maintain a separate contract in the north and a separate contract in the south. So although there are vendors with the ability to offer statewide networks, so for example, you have Anthem, who is probably one of those networks that would be able to offer a statewide solution, it is important to recognize that there's potential vendors both in the north and the south that are limited geographically. So they can only offer those networks either in the north or in the south. So while a single statewide network is administratively less burdensome for PEB to maintain, limiting the RFP solely to a statewide option will likely limit the pool of potential vendors that respond to that RFP and also reduce that competition as well. So as we move forward with the solicitation, there's a few options that have been identified. The first one is to create a solicitation requesting proposals for a statewide network. So this option requires the respondents to provide a PPO and EPO network for services and coverage throughout the state. The second option is to create a solicitation requiring proposals by region. So this is now we are limiting ourselves to more than one contract essentially. So we have a north and a south, or maybe a rural as well. This option requires respondents to provide PPO and EPO network services based on the region and will likely result in at least 2 separate contracts with 2 separate providers. And then there's option 3, and that is to create an open-ended solicitation that allows respondents to submit either a statewide proposal or a region-specific proposal. And so this option 3 really will increase the number of proposals, likely increase the number of proposals and access and cost options that PEB can consider as a result of the RFP proposal or bids that come in. So this could result in the award of 1 statewide network, and it could result in possibly 2 separate regional contracts for PPO or an EPO services. It depends on what comes in, but we're leaving the options open and allowing vendors to tell us what they can provide. So again, a draft overview and scope of work for this RFP is available in the attachment B at the end of the report. The recommendation on this one is to approve PEB staff to proceed with a request for proposal for PPO and EPO network services using that option 3. So I'll pause there for questions.
Board members, any questions?
Yeah, this is David Smith. I have a question. On the attachment B, because your staff has already developed this, the scope of the RFP, will there be an opportunity to add things to that? for example, with respect to the northern and southern network, if they're two different networks, the benefit of having a statewide network is if an employee moves, they're going to be still covered within their plan, or if they're traveling, they're going to be able to get the discounted rates based on that. So I would just want to make sure that if we are going to look at them submitting regional networks, that we ask them whether or not they would cover, they would provide a reciprocal discount if a northern employee is down in Las Vegas and gets hurt or gets sick, those types of things. So I just don't know if the development of the RFP, if the board members who are going to be participating in the evaluation of the RFP, if they'll be able to participate in the development of the requirements of the RFP, so we can make sure we have some input. So I guess that's my question for Laura.
So for the record, Laura Rich, the RFP is not developed. There's obviously a scope, and we do have the previous RFP to kind of use as a roadmap. We are definitely willing to take any input and suggestions and requirements from the board members, in that development process as well. So I'm all ears if there's anything that the board would like to have included in that. I'm happy to hear suggestions.
Okay, thanks. Well, if at this meeting, and Laura, I'm not sure if we're going to decide if we're going to take volunteers today or if that's going to be different or later as far as participation on them. But I would just recommend that whoever is going to be part of the evaluation team, that perhaps they be part of the development of the RFP as well, with staff, obviously. And just my thought.
Are you volunteering, Mr. Smith?
Absolutely, I'll volunteer
Okay.
to participate on it. I'm interested in the network, so yeah, I'm happy to volunteer.
So noted.
Yeah, Mitchell, for the record, I actually have a question for Chair Freed about her comment, discussion on the 4-year guideline policy. I noticed in attachment, for example, in attachment B that we're discussing now, it's length of a contract anticipated 6 years. We're obviously not drafting any kind of overview of project now, but just as a general guideline or general discussion, can you say a couple more things about that 4-year? I just want to be clear because I don't have any color around that 4-year guideline or policy.
Yeah, you broke up there, but I think I got the substance of the question. Yeah, in the attachments, both the enrollment and eligibility, the PPO network, and the dental network, in those scopes of work, the suggested length of the contract, I think it's from the purchasing division, maybe not necessarily specified by PEB, although I'm sure Laura Rich will correct me if that's wrong. In those 3 scopes of work, the suggested term is longer than 4 years, and that caught my attention too. So Ms. Rich did make some comments as to why that might be advantageous, but I think that's discussable because the state administrative manual specifies that it's a general policy of the state that contracts should be bid at least every 4 years. With respect to big provider contracts like you would see in PEB and Medicaid, I think that there's some good reasons why some of those contracts could be longer, owing to the need to move IT files to a new vendor, disruption to participants, possibly having to get new providers. But in general, and if the LCB is going with this audit where I think they're going, I think they're trying to tell us that PEB has gotten into a bad habit of extending its existing contracts rather than going out to bid. So that was really the stimulus for my comments, but I'll let Ms. Rich talk about the possible fiscal advantages of having a contract term longer than 4 years.
Right. So Laura Rich for the record. Yeah, sometimes if you have a longer contract term, you can obviously leverage better pricing. So there's that. But just as important, especially in this one, and I think we could justify a longer contract term on this one because of the disruption to members. You don't want to switch up your networks because members, they establish relationships with those providers. And if that provider is not in the new network, they have to switch providers. So you don't want to do that. You want to minimize that disruption as much as possible, this is also something that we would look at when we do the RFP, and during that evaluation committee, it would be we would do a gap analysis of, what providers do we have in the network today versus what providers are being offered in these proposals. And so it really does make sense to maintain that contract for continuity. This one, I believe we would be able to justify a longer contract term versus a shorter contract term.
Jet Mitchell, for the record, thank you, Laura Rich, for clarifying that. My comment would be it may make sense in RFPs, proposals, in documentation to have that really good verbiage about the importance of the continuity to show the rationale, so that it just doesn't look on its face to say the length of the contract is 6 years and then have someone be looking at this saying, well, this may not be best guidelines because it's greater than 4 years, because the continuity need outweighs the length of contract consideration. So I think it may make sense to put a couple of sentences in there just to show that, because that definitely makes sense. And then I will join David Smith and volunteer to chair Freed for the statewide PPO.
Thank you. All right.
Madam Chair,
Yeah.
if I can chime in one more time. And this is just a thought that perhaps looking at all the contracts, that they be staggered so that they're not all coming due at the same time. Each one of these are a tremendous amount of work, and I know Laura Rich's staff does a great job putting things together, but to have them do them all at once is going to be really tough. So if we're looking at some of them being longer than 4 years, perhaps grouping those ones that should really be coming up together, and then do the other ones at a shorter time so that they fall in an off cycle.
Agreed. Thank you.
Yes, Madam Chair, Tom Verducci for the record. As a private sector person, RFPs would always scare me in the past, but I've learned over the years with the nature of competition, you always end up getting better deals, price breaks, and there's a lot of costs that are associated with the private sector, but I do think it is well worth it with the time. And if there's room on this evaluation committee, I'd also like to volunteer to be on it.
Thank you. Okay.
And for the record, Laura Rich, to David's point, yes, I think this was an unintended consequence of some extensions. And so all of the contracts aligned. And believe me, no one at PEB is happy about all the work that's in front of us with 5 contracts. There's actually another one, which is a much smaller website one that we'll be bringing to the board at a later time. But yes, we have a lot of work in front of us, and this is something that I definitely want to fix, because this is not ideal for PEB staff, and definitely not ideal for just the program in general, because of the overlapping that is required, and budget building also on top of that. We have a lot of unknown variables at this point. So, and also, I know I'm appreciative of the volunteers, and which is great. But we have 4 others too. So just reminding, you might not want to volunteer all at once because we have 4 other contracts as well.
Yeah, board members, fair warning, you're probably going to be voluntold.
Tom Verducci, for the record, it might even be a good goal for us, for each one of us to try to be on 2 of these evaluation committees. I do think the more involvement from the board at the stage that we're in right now would make a lot of sense.
Okay, that sounds good.
Well, Madam Chair,
Mr. Bailey, go ahead.
yeah, for the record, well, maybe you want to go through the process of RFP. It involves state purchasing, and it involves a number of board members that should be on an RFP. I mean, these are already structured rules that we must follow. And I'm not sure everybody understands that. It's gracious that everybody volunteer, and I'd be one of them, but I'm just pointing out that there are 5, probably going to be 6 contracts to be reviewed, and they put what they do in the past. They've taken board members and separated them, and I think it's been 2 about per contract. I think that's what purchasing likes. And then purchasing, I think, has 2 people on for the review, and then they have an outsider on for the review. So it's a simple mechanism, but it takes a lot of people. So I just thought I'd bring you up to date on that one. Thank you.
Thank you. On the usual composition of a review panel, if you know it off the top of your head, because I don't think I know it off the top of my head.
I think you cut out, but Laura Rich, for the record, you were asking for the composition of a review panel. If Carrie Eaton, you're the contract person, you probably would know, but I know that there has to be an outside person, one outside person on the evaluation committee that is unbiased. So it can't be staff, it can't be a board member, it's got to be an outsider. Beyond that, I don't think that there's any specific rules. Carrie, do you want to chime in on that one?
I think there are specific rules. I don't know all of them off the top of my head, so don't hold me to everything I'm going to say. I know as far as staff, you can't have more than 2 staff that report to someone on the committee. And you, as the executive officer, cannot be on any of them, lucky. And then, yes, an outside person could be from another state agency, could be just a general member of the public, it could be anybody. And then I don't recall the number of board members, but I know that is encouraged to have at least 1 board member.
I don't believe we've gone through the financial auditor portion of the staff item. Is that?
Yeah, so we need to do the dental network and financial.
Oh, I'm sorry. Okay, dental.
So the dental network, PEB contracted with Diversified Dental for dental network services initially on July 1st of 2005. And then an RFP was again completed in 2008 and again in 2013. Diversified Dental was selected as the winning vendor in both of those solicitations. The contract is set to expire on June 30th, 2021. And again, a draft overview and scope of work for this RFP is available in attachment D for the board to review. And the last one is for the financial auditor. So PEB contracted with Casey Nealon for financial auditing services. This initially was done in 2010. Another RFP was done in 2015, and Casey Nealon was again selected as the winning vendor. So the current contract began in 2016 and is now set to expire in 2021. And I'm sorry, I skipped it. The above for the dental network, the recommendation was to proceed with an RFP for a dental network provider. And again, the same recommendation is for the financial auditor as well, to approve PEB staff to proceed with an RFP for the financial auditor as well.
Laura, I think you may have skipped over the HMO contract.
And I did. Thank you. So there's the Southern Nevada Health Maintenance Organization, or HMO. PEB's Southern Nevada HMO contract was offered by Health Plan of Nevada initially in 2012. And an RFP again was completed in 2016. And again, HPN was selected as the winning vendor. That contract is due to expire in 2021. As you heard Chair Freed discuss, we have been looking at different plan options and a different structure moving forward. But we want to make sure that we have the option to maintain the HMO in the South. So in plan year 2018, PEB opted to eliminate the Northern HMO. So we don't have a Northern HMO, but we do have a Southern HMO. And right now that board policy is to blend the higher and the higher price Northern Nevada market with the lower price Southern Nevada market costs with that, Southern HMO. This has caused some migration away from the HMO plan and is probably producing a problem that will eventually, if not immediately, need to be addressed. However, those discussions have happened through strategic planning, and I believe we have addressed some of those potential solutions for that. So as PEB works with our partners to develop potential solutions, we need to simultaneously move forward with an RFP to ensure that PEB is able to meet those solicitation and implementation timelines, and that we can continue to offer this product in the South. So the PEB recommendation for this is to approve PEB staff to proceed with a request for proposal for a Southern Nevada Health Maintenance Organization, or HMO provider. And I'll take any questions.
Doesn't sound like the board has very many questions or comments.
David Smith, for the record, I would just, Laura, if you can, if it's okay, send out an email with the contracts that you'd like board members to participate on, and then we can all just respond with which ones we're interested in. And I'm happy to volunteer for 2 of them. So.
And Brandy, I don't know if you want to maybe add anything as far as, we need to ensure that we maintain or we adhere to open meeting laws, as far as working with board members to maybe even develop the scope of the RFP. Do you want to maybe give some guidance on that? You're on mute.
Sorry. I was just trying to research who needs to be on an award committee. But yeah, if the board is going to delegate some of these decisions to a subcommittee of board members, then any of that group's deliberation and decisions will need to be done in an open meeting. So we can work together on that and figuring out if you want to have more than one board member on each committee, then we'll figure out how to notice those properly and abide by that. Or the chair may just appoint one board member to each committee if that's appropriate. I'm researching that. in which case that would not be a subcommittee of the board. So definitely we'll keep an eye on that and determine how you want to handle it.
Okay, I think my preference would be just to appoint one, because I was flipping through my collected contract training materials over time, and I think that Carrie's recollection is probably correct, that there is not a set number and composition of folks on a review committee, but I'll continue to look at that. So anyway, but to avoid any OML concerns, I'd be happy just to appoint one board member.
Madam Chair, David Smith. I just pulled up NRS 287.0415, and the board can hold a closed meeting to prepare an RFP. So we could actually meet, and hold a closed meeting to talk about the contents of an RFP. It doesn't look like we're exempt from considering it or as a subcommittee, but I know Brandy's going to look into that also. So, but
okay.
It would be good if, board members meet at least to go over what we'd like to see in them.
Okay. So for now, the business before us is to take action on issuing an RFP for these 5 different contracts that are up in 2021. So I would entertain a motion to proceed with the RFP process for these 5, if that is the board's feeling.
This is David Smith, so moved.
All right, do I have a second?
Jet Mitchell, for the record, second.
All right. So again, I'll do the roll call so we don't all shout aye or nay and cancel each other out. All right, I vote aye. Mr. Bailey, how do you vote?
Yay.
Okay. Ms. Fox?
Aye. Did you hear me? I vote aye.
Okay. Ms. Lamborn?
Aye.
Ms. Mitchell?
Aye.
Mr. Smith?
Aye.
Mr. Verducci?
Aye.
Ms. Krupp?
Aye.
Okay, thank you. The motion passes of all the members present. Okay, let's move on to agenda item 9, discussion and possible action of contract amendments for Aon and HealthScope.
Actually, can I pause right there? We also need to vote on the cancellation of the Morneau Chappelle contract amendment as well.
Oh, thank you very, very much for keeping me on the legal straight and narrow. Since we voted to move forward with an RFP for all 5, I feel like this is a foregone conclusion. So I'll need a motion to cancel the amendment till 2023 with Morneau Chappelle.
For the record, I wanted to clarify what the motion is again. Can you say that again, please?
The motion would be to not honor the contract extension with Morneau till 12/31/2023, owing to Morneau's failure to meet its deliverables, which they have already acknowledged they failed to meet.
Jet Mitchell, for the record, I'd like to make that motion.
Okay, do I have a second?
Linda Fox, so second.
All right. I'll make this I'll make this easier than a roll call. If anyone votes no, please speak now. Okay, I think we all voted aye by default. Brandy, is that okay with you? Okay. All right. Thank you for that, Laura.
Hi, Chair Freed, Jet Mitchell for the record. When David Smith earlier was referencing an NRS, I thought he was referencing 287.04345. And in fact, I believe, Dave, that you were referencing 287.0415. But I just wanted to note, I think as far as our discussions, 287.04345 may also be relevant here. So as far as our meeting. So before we get too far away from that, I wanted to throw that in.
Okay. Thank you for putting that on the record. I appreciate that. Okay, are we clear to move to agenda item 9? Okay, so with that, I will turn it over to Ms. Eaton or Ms. Rich, whichever.
I'll take it. Thank you. Carrie Eaton, Chief Financial Officer for the record. PEB is requesting that the board authorize staff to complete $0 housekeeping non-extending amendments for 2 contracts. The current Aon Consulting contract began July 1st, 2016 for a 6-year term. The Aon fee schedule restricts contract authority to specific categories or buckets of authority and fiscal year caps. These buckets restrict our ability to utilize Aon as we need from year to year. And the fee schedule on this contract has been incorrect since the beginning of the contract. The original RFP cost proposal included options for a 4, 5, or 6-year contract with a corresponding cost option. And the 6-year contract, the 5-year cost option was used inadvertently in the final contract. So this proposed amendment will restructure the fee schedule to allow more flexibility by eliminating the specific buckets of authority and reallocating the remaining contract authority through the remaining years to ensure PEB has sufficient contract authority to use and pay Aon for the remainder of the contract term. Again, this amendment does not add additional authority or extend the contract, and basically just cleans up the fee schedule so that PEB has authority to use and pay Aon for the rest of the term. And I can pause here and answer any questions about the Aon amendment. Our TPA contract with HealthScope Benefits also began July 1st, 2016 for a 6-year term. While the RFP response to this contract included language to allow HealthScope Benefits to conduct medical reviews from nurses and physicians, the fee for physician medical reviews was not included in the fee schedule that was attached to the contract. So this proposed amendment will amend the fee schedule to include physician medical review costs to ensure that the fee schedule encompasses all fees that PEB could possibly anticipate paying for. So PEB recommends the board authorize staff to complete a contract amendment for Aon Consulting and HealthScope Benefits TPA contracts to amend the fee schedule. And I can answer any questions.
Yes, Madam Chair, Tom Verducci for the record. It looks like what we're doing here is we're amending the fee schedule, but did I hear Carrie correctly that there is no definite term that we're actually adopting here? Is there any term of this contract, any expiration?
Yes, both of these contracts end June 30th, 2022. And I just wanted to say these amendments will not extend the term of the contract or add any additional authority to the contract. They're very housekeeping.
Wonderful. Thank you very much for the clarification.
So how much is a physician medical review as compared to the nurse reviews we do currently And how many of them would we do?
I believe the nurse reviews are $85 per review.
Okay.
And the physician reviews would be $170 per review.
Okay.
I think the physician reviews are very rare. We haven't done them.
Okay.
But I think there are a couple that are pending. So they're just for specialized cases,
okay,
as far as my understanding.
Okay. All right. With that, if the board doesn't have any additional questions or concerns, I'd accept a motion to approve the processing of these two contract amendments.
Don Bailey, so move.
Thank you. Do I have a second?
Jennifer Krepp, I'll second.
Thank you. Okay, I'm back to my roll call. Mr. Bailey.
Aye.
Ms. Fox.
Aye.
Ms. Lamborn.
Not hear that?
I'm sorry, I didn't hear that.
Oh, Madam Chair, I'm sorry. Yes, aye.
Okay. Ms. Mitchell.
Aye.
Mr. Smith.
Aye.
Mr. Verducci.
Aye.
And Ms. Krupp.
Aye.
Thank you. Motion passes unanimously of the members present. All right. Our next item is the health claim auditors, audit of health scope benefits.
Thank you, Madam Chair, members of the board. For the record, my name is Robert Carr, C-A-R-R, and I represent Health Claim Auditors, Inc. Can everybody hear me? Okay, I see all the nods. Thank you. Last month, Health Claim Auditors performed an audit of the claims administered by Health Scope benefits during the period of January 1st, 2020 through March 31st, 2020, which is PEB's third quarter of fiscal year 2020. This audit consisted of a random selection of 500 medical, inpatient, and outpatient hospital and dental claims, in addition to numerous large claims audited on a biased basis. Random claims are selected in a statistically valid process from both PEB's Premier Plan and the Consumer-Driven Health Plan to ensure that the plan benefits are loaded into the Health Scope system and adjudicated accurately per your master plan document. Any agreement, benefits, and the industry standards that are utilized for all policies and practices as they pertain to functions such as subrogation, coordination of benefits, ICD-10 suites, and the numerous procedures necessary to ensure the best accuracy and cost containment for PEB. The review and audit of claims outside the random selection are considered biased and can be reported but not included within the statistical calculations of your performance guarantees. When conducting the audit, we also audit ancillary and related claims to the random selected claims. For example, if the random claim brings up a surgeon's bill, we will also review and audit the hospital bill, the related claims such as the assistant surgeon, the anesthesiologist, the labs, and any other related claims to that claim. Most audits will review the basics such as the contract rates, benefit applications, duplicates, and timely filing. The real shrinkage in your plan and in all plans today occur from undetected actions from the billing communities for claims that contain things such as upcoding, code creeping, unbundling, multiple surgical reductions, just to name a few of the hundreds of the deceptions and the games that really good administrators such as HealthScope have to deal with. To give you an idea of the scope of your audit, currently, of all the audits that we do throughout the United States, about half do not make the performance guarantees or the industry standards. This audit was conducted to ensure that all metrics within the HealthScope RFP are measured of HealthScope's performance. However, if any defects are detected that are not the responsibility or accountability of HealthScope, such as incorrect pricing of the contract rates by the network, errors caused by providers, or outside sources not in HealthCo's control. The errors displayed within their report, but not, again, calculated into the statistical calculations. The findings for this audit reflect that HealthScope passed all negotiated performance guarantee levels pertinent to payment and financial accuracies of claim payments, turnaround times, data reporting, any possible data breaches, and all customer service levels. In respect of all categories reviewed in this audit, we found that the HealthScope adjudication system continues to function at a high efficiency level with only 12 error types detected within this quarter that were attributed to HealthScope functions. None that possessed any large dollar errors or concern on our part. However, we did recognize that some of the non-charge errors were of concern due to incorrect network repricing causing payment errors by our calculations from $190 to an excess of $16,000. All previous findings with recommendations that were approved by this board were found to be implemented by HealthScope at the time of this audit. The identified overpayment dollar volume is within agreed levels at $2,076,000. A large portion of the overpayments were found to be primarily as a result of the claims sent for collections due to network repricing or network pricing adjustments from both major networks within the PEB statewide networks. It's important to note that of the most current identified overpayments for plan year 2020 to date, 55% of the claim count volume were found to be caused by external causes and were not a cause of the HealthScope adjudication processes. Open potential subrogation cases at the time of this audit remained steady at $3.3 million of paid claims, with the soft denial claim level increasing to 4,521 claims, representing $25,600,000 valued in charge dollars without discounts or benefits applied. Claims within the denied category were reviewed, and they were all found to possess legitimate reasons for each claim being in appended status. As for the dedicated home HealthScope personnel assigned to the PEB account, changes during this audited period included both the 2 eligibility specialists and the change of 3 customer service representatives, retaining a total of 18 that are dedicated to the PEB plan. One item of concern in our previous reports associated with the hometown health contract letters of associations, or LOAs as you know them, with PEB claims have been resolved and is now functioning as it should be. As a final note, in observance of the skill sets and the deliverables by personnel and the policies, procedures, and system edits applied during this audited period, it remains our unbiased opinion that HealthScope remains a very qualified administrator, vendor, and a good PEB partner. With that, Madam Chair, that concludes my presentation.
Thank you, Mr. Carr. That's good news. Board members, comments, questions for health claim auditors?
Yes, Madam Chair, Tom Verducci for the record. Bob, could you just touch on the one fail in the category of customer service and the survey in terms of satisfaction? I notice everything's passed, but we do have one fail there. I was wondering if perhaps you could just address that.
I have a failure in my next presentation, but I don't recall one on this one, Mr. Verducci. Take a look at what we show here. No, sir, I don't reflect that in with HealthScope. I do reflect it in my next presentation.
Okay, I'm reading forward, so do excuse me there.
Yes, sir.
Okay. Anyone else? All right, this is an action item, so we would need a motion to accept the audit.
This is David.
Madam Chair.
I heard from Ms. Smith and Mr. Bailey at the same time, so
I will second. I will second the motion.
All right. Okay, so I'll do my roll call again. All right, it's been moved and seconded to accept this audit. Mr. Bailey.
Aye.
Ms. Fox.
Aye.
Ms. Lamborn.
Aye.
Ms. Mitchell.
Aye.
Mr. Smith.
Aye.
Mr. Verducci.
Aye.
Ms. Krupp.
Aye.
Great. Motion carries unanimously. I think we can move on to the next audit, which is of ESI.
Thank you again, Madam Chairman, members of the board. Again, for the record, my name is Robert Carr of Health Claim Auditors. Over the last few months, we have performed a prescription benefit manager or PBM audit of Express Scripts on behalf of your benefit plan for all the prescription drugs as per the terms set forth within the request for proposal 3220 and the renegotiated terms within Amendment 2, Attachment EE that was effected for this audited period. This audit included 100% review of all the prescription claims processed by Express Scripts from July 1st, 2018 through June 30th of 2019, or PEB's plan year 2019. The audit included all performance metric guarantees identified in the agreement, plus numerous additional categories in addition to operational policies and procedures. We want to assure you that we audited these categories to the fullest extent, plus provided and reviewed this report with our findings and the data in a non-redacted format to PEB officers. However, Express Scripts considers the guarantees and the majority of the audited metrics to be proprietary and confidential for competitive reasons. Therefore, due to the public, general public's exposure today, the report provided to you is redacted to the satisfaction and verification of both PEB and Express Scripts to be in compliance with the contracted agreement language and requirements. Nobody ever wants to talk to me until I get on. The majority of the discounts provided to PEB in your contract are based on a percentage measurement of average wholesale pricing, known as acronym AWP. Due to our experience with receiving incorrect PEB data from prescription benefit manager vendors prior to Express Scripts, testing on this data was conducted and we concluded that each claim's correct and accurate AWP was applied per the 2009 National Class Action Lawsuit that was effective of AWP pricing. Audit results revealed that Express Scripts was found to meet or overperform the agreement guarantees in the categories of discounts for retail name brand drugs, 1 to 83 day supply, and 84 to 90 day supply also. Also within the agreement met was the mail order name brand drug claims and the dispensing fees for all categories with the exception of retail name brand 84 to 90 day supply and the retail generics 1 through 83 day supply. Customer service levels for telephone response time, abandonment rates, first call resolutions, and the percentage of network pharmacies in the proximity to your participants were all within the negotiated metrics. The administrative fees were calculated and charged correctly. Shipments of mail order claims to PEB participants were delivered within the contract late lapse time guarantee. Data reporting to PEB was delivered within the agreed timetables, and utilization management and applications of drug utilization review edits were applied properly. It was also recognized that Express Scripts provided an excellent distribution of specialty drugs within the coordination of PEB's third-party administrator, HealthScope. Per agreement, PEB is to receive 100% of manufacturer rebates with a specific guarantee for each name brand drug category that was dispensed through retail, mail order, and specialty pharmacies. Quarterly rebate payments made to PEB for plan year 2019 reflect the Express Scripts satisfied the agreement and the remitted amounts were in excess of the guarantees. This report displays the finding of each drug category as independent of the others within the areas of discounts and fees. However, The intent of the agreement is to aggregate the results of all guarantees for discount rates and dispensing fees for one total over or under performance measurement. Our findings and for this audit and Express Scripts year-end true-up for each category match or differ slightly. However, we both agreed on the aggregate results delivered to PEB and which is presented to you today. The categories of retail generics, mail order generics, and specialty drug claims within the discounting guarantees and the dispensing fees charged to PEB in the categories of retail name brand 84 to 90-day supply and retail generics 1 to 83-day supply independently underperformed their guarantees. The aggregate metric delivered to PEB for plan year 2019 for discounting and dispensing fees was found to be $1,924,753 less than the negotiated guarantees within your agreement. It's important over the last 20 years that we've been your external auditor and conducted and detected shortfalls similar to those that I've presented to you today. It was typically due to a deficiency or errors as a result of manual or systematic malfunctions from the PEB vendor. It's very important to note that this is not the case here. The $1.9 million shortfall is not a result of Express Scripts executing claim errors, poor policies, practices, or functions to PEB. This is a result of the PEB participation mix of drugs and pharmacy utilization, in addition to the distributions within the aggressive new discounts that were renegotiated by PEB for this period. I say kudos and congratulations to you because of that. But we found, and it was verified by HealthScope, that there were also no exceptions to the guarantee for Express Scripts to deliver claim data files to PEB's third-party administrator by 12 noon each business day. Per agreement, an annual program satisfaction study, this is what Mr. Verducci was talking about, is to be conducted of plan participants who have used the pharmacy benefits, of which 90% or more participants must provide a satisfactory level of services that they received, or a penalty of 0.25% of the annual administration fees paid for each quarter or fraction thereof below the guarantee can be assessed. Per the customer satisfaction survey results obtained, Express Scripts underperformed, with 88% of your respondents stating that they were overall satisfied. This underperformance result calculates to a penalty of $6,301. In conclusion, the Express Scripts adjudication systems edits and drug utilization review edits that were tested were found to follow proper protocol and practices in all areas delivered to your participants. We found Express Scripts to be in compliance with all guaranteed metric measurements and benchmarks, with the exception of the aggregate claim discounting and underperformance of the satisfaction survey. It is our unbiased opinion and recommendation that PEB collect the $1,924,753 discounting shortfall and the $6,301 penalty for the customer service survey underperformance, for a total of $1,931,054 as presented to you today and as per your current administrative contract in force. As a final note, PEB, you should be recognized and congratulated for the 7% distribution of generic drug utilization of all retail and generic order claims. This distribution is among the highest in the nation and helps in driving an overall cost to PEB participants and the PEB plan itself. With that, Madam Chairman, this concluded my presentation.
Thank you very much for that comprehensive report. Board members, questions, comments?
I have a question for Laura Rich. This is Linda Fox. When is the contract up?
For the record, Laura Rich, Carrie will have to confirm, but I believe it's 23, is it? ESI contract? I believe it's June 30th, 2023 as well, but I will double check right.
Thank you.
For the record, Jet Mitchell, I have a question for Mr. Carr, on what page of your very comprehensive report do you list the payment due to the shortfalls, the $1 million payment to PEB due because of contract shortcomings? What page are you referencing then when
Ms.
you?
Mitchell, that is actually a couple different places, but the easiest place to find it is in the executive summary conclusions and recommendations on page 4 of the report. That would also more directly be column 3 of page 4. I should say column, and paragraph 4 also is the customer survey.
Thank you. I was also reading in the weeds of the details as well. Thank you.
Well, thank you for reading it.
Thank you for a thorough audit. Thanks.
And just to clarify, the ESI contract is expiring on June 30th, 2022.
Okay. Okay, I am not seeing any additional questions. This also is an action item that requires acceptance of the conclusions and recommendations in this audit to include the $1,924,753 underperformance for plan year 2019. Do I have? Yeah.
Our recommendation would also include the $6,301 penalty of the, I didn't know if you needed to add those together or not.
I do, I think, yes. So the underperformance guarantee and the penalty would be included in accepting health claim auditors' recommendations and conclusions of the audit of ESI.
Mr. Bailey, I recommend we accept the health claim auditor's reports.
Thank you. Do I have a second?
Jet Mitchell, for the record, second.
Thank you. All right, I will call the roll on the vote. Mr. Bailey.
Aye.
Ms. Fox.
Aye.
Ms. Lamborn.
Aye.
Ms. Mitchell.
Aye.
Mr. Smith.
Aye.
Mr. Verducci.
Aye.
Ms. Krupp.
Aye.
And I vote aye. All right, thank you. Motion carries. All right, that brings us back to our second public comment period, and I will turn it over to, I think, Mr.
Thank you, Madam Chair. I'm going to go ahead and start sharing. Okay, again, for the public comment, I'm going to go ahead and read the last 3 digits of your phone number. Once those are announced, your phone will be unmuted. You should hear an audible tone that says your phone is unmuted, and then you can go ahead and proceed with your public comment at that point in time. The first one on the list that we have is 920. Your phone is unmuted. Your phone is unmuted for public comment. Okay. The next one we have is 207. 207, you're now unmuted. The next one we have is 642. 642, you're now unmuted. Okay, the next one we have is 800. 800, you're now unmuted. Okay. The next number we have is 646. You are now unmuted.
Hello?
Yes,
Hello,
hi.
can you hear me?
Yes, we can hear you.
Okay, fine. I just have a comment with regard to, I've been part of PEB for like 30 years, and I'm usually outside of Nevada. So I've just had a really, really bad struggle the last few months when I've tried to find a dental provider. And I think diversified, that the insurance card's really confusing. And I would recommend a reformatting of that thing, because it says when you're outside of Nevada, you use principal plan. And when you choose a dentist off a principal plan, you find out that I found it that HealthScope reviewed it, and it was not an eligible dentist. It was also confusing for the dentist. In fact, the other day I had two dentists trying to contact HealthScope, trying to figure out if they could be used, and they were getting hung up on. And I know I've contacted HealthScope before, even about the way, because there used to be First Health, both for dentists and for the physicians, and it was very easy. So I was even trying to find a position with Aetna. First Health was telling me the position's not there, even though I'm staring at it. The other day, I called HealthScope about a dentist. I'm staring at the dentist, and they're telling me it's not there. I call back again. I get a different person who tells me, yeah, no, that dentist is part of it. So it's really, really causing some trouble. Whereas with First Health, I never had these issues. And HealthScope, the other problem with HealthScope, they've become kind of rude over the past, in the last year or so. I've sensed a great dissatisfaction with them when you call them, and I don't know why. And the other issue I had was even trying to figure out who to register this complaint or problem with. I had a lot of trouble trying to identify who does anything with PEB. I called UNLV numerous times, the HR department, and they, nobody there knew who I was supposed to talk to. So, over 30 years, it was just surprising to see that when you need to figure out who's in charge of anything, I wasn't able to do it. So anyway, that's my comments, and I don't know what to do about the health plan issue. They've limited to it's almost impossible for me to currently find a dentist that is usable. Most of them are like really low income types, they'll make work when you go to their office, which I, had plans years ago where you buy the plan, for like $49 a year or something. And then you go there and they start making up work. And so that's why in the past with First Health, I had, a good choice.
Madam Chair, can we have the members state their name for follow-up purposes and for the record?
Sure. My name is Deborah McGill. And if you need the participant ID, I can provide that, but I have to pull it off my other thing.
No, I don't think that's necessary, Ms. McGill. Just your name and if you could spell it for the record.
Sure. It's DEBORAH. The last name is McGill, McGill. Because in the past, I had two premature children that were born at UCLA. We had a lot of stuff that went on that used to be smooth sailing. But this thing with the dentist, and then also recently trying to find physicians that for some reason there's this big problem with them. Even when you call and you say, I'm staring at the PEB website, I see this doctor. And they're saying, no, he's not there. Because at this point, I don't want to go near a dentist or a doctor before I call HealthScope and make sure that they really are on the network, and it's kind of maddening that you have to do that. Anyway, so those are my comments.
Thank you very much.
Okay, the next one we have is 688. 688, you're now unmuted.
I'm just listening.
Okay, thank you. The next one is 837. 837, you're now unmuted.
Hi, this is Kent Urban with the Nevada Faculty Alliance. I would like to thank the board members very much who volunteered to serve on evaluation committees. That's a very important function, especially for these major contracts that are going to influence plan design in the future. I would like to give some background on NRS 287.04345. That was created as SB 502 in the 2017 session, specifically to address concerns really with RFPs at PEB that went south in a big way and were controversial. And it's meant to help PEB do this process better. There are several aspects to it. The main one is that any number of board members may be appointed to the evaluation committee, and that evaluation committee is run by, through the purchasing department and is specifically exempted from the open meeting law so that you can have a proper confidential evaluation of all the bids. There are some restrictions on that. Obviously, you can't do other board business, but the idea is to allow board members to serve on that evaluation committee and provide input and then actually buy in for the eventual awarding of the contract. Then once the evaluation committee rates all the proposals and selects the highest rated vendor, the only thing the board can do in a public meeting is award the contract that was selected or cancel the whole RFP and start over. So it's really very important that board members are involved in the evaluation committee process, especially when things like full state versus partial regional contracts are going to be considered at that level and will come to the board as a take it or leave it proposal. The other thing I want to mention is in NRS 287.04345, number 2, it says the board shall act as the chief of the using agency for the purposes of NRS 333.335, which is the RFP purchasing statute. What that means, it's the board as a whole that decides who are the members that serve on the evaluation committee. So I appreciate all of those who volunteered, and it will be the board who decides who those members are, the board as a whole. Thank you.
The next one that we have here is 338. You're now unmuted.
This is Priscilla Maloney. Can you hear me?
Yes.
Thank you. This is Priscilla Maloney with the AFSCME retirees. That's PRISCILLA for the record, MALONEY. I'm sorry, I tried to get on at the first public comment, so I'll make this brief. Thank you very much for all the hard work the board is doing. We certainly appreciate what the entire state workforce is doing to carry on for Nevada during this difficult time. Just want to join in support of both Dr. Irvin's comments on agenda items number 5. And number 5 was the executive officer report, but the reference specifically to the request for information regarding a second look actuarial study. And then agenda item number 8 on the contract renewals. And again, I joined Dr. Irvin on that we appreciate all the board members who are willing to volunteer to be on that evaluation process. So thank you very much for all the hard work that everybody's doing, and please stay safe. Thank you.
The next number we have is 755. 755, you're unmuted.
Hello, this is Marlene Lockard representing RPEN. And I too was going to point out SB 502 of the 17th legislative session. And I think Dr. Irvin summarized it correctly. But I did want to say that this bill was a result of tremendous cooperative efforts of the then director of the Department of Administration, other administration officials, and advocates for the public employee benefits program. So we all felt this was a very good legislation that was an attempt to resolve some pretty serious issues that had developed over that period of time. So I would recommend that, or hopefully suggest that the new board members take a look and review SB 502 because it does have other issues contained in it other than the contract language. Thank you very much.
The next person we have is 404. 404, you're unmuted.
Good morning. Can you hear me?
Yes.
Thank you. Good morning, Chair and committee members. My name is Kevin Rampt, a labor representative with AFSCME Local 4041, representing numerous state employees. In item 6, during Stephanie's presentation, as she stated, there are a lot of unknowns and both that really impact the pandemic and is very fluid and is continuous, as we all know that, we don't know what this is going to predict. To say really that this is going to be numerous millions of dollars is an unknown. Recently, consulting firm Willis Towers Watson released a report in April estimating that large self-insured employers could see a 7% rise in the 2020 cost due to COVID-19. But then in May, the same group, the same firm, did a reassessment and released a new report projecting that employers' costs could actually decrease by 4% due to the COVID-19 pandemic. So there's a lot of uncertainty, and this thing can go back and forth. And I appreciate all the effort and time that everybody's putting into this. It just there's so many unknowns that we really can't say other than continue to do projections. But we don't want to see it. We don't want this to be done on the backs of state employees, especially with these unknowns. As there's a great deal of uncertainty and varying projections surrounding the pandemic, whether they are aligned with science so far or whether the level of confidence in those projections. We ask that all claims from the COVID-19 come from the catastrophic reserve funds, so the financial health of the plan is not disturbed. And we ask that PEB continue to work with the GFO's office to request reimbursements from possible federal funds that may be available for COVID-19 funds in general. We are a Me Too from Dr. Kent Irving's and Ms. Lockhart's opening and closing public comments. In regards to agenda item 5, we would also like to see that actuarial as well. In regards to agenda item 8, on the RFPs, we look forward to seeing an open and competitive bids that produce the best outcomes, that provide affordable costs and provide the best benefits for all participants. On the RFPs, I am not sure if anything could be written on the RFPs to specifically address how vendor plans could be actually written into that RFP addressing the COVID-19 pandemic benefits and cost. But that may be something to look at, just try to kind of see what each individual vendor's plan is, and that may help with the selection, especially with the cost. In closing, I want to state that the PEB board, as the PEB board moves forward and discusses changes that impact plan design benefits, they can have a significant impact on state employees' retainment. Numerous state employees look at the PEB health plan benefits for them and their families as a factor to decide if they want to make state of Nevada a career choice. Between the unknowns of the governor's plan on compensation, we ask that everything be considered before future benefit plan design changes are considered for the next biennium. I wish everybody the best of health, and I thank everyone for their time and appreciate all the hard work that staff is doing as well. Thank you.
Madam Chair, that was the last caller for public comment.
Okay, thank you. That brings us to the end of our business. So unless anybody else on the board has any comments or staff has comments, I will just note that our next meeting is scheduled for the end of July. I believe it's July 23rd. And I wanted to thank everyone for their participation this morning. And once again, welcome our newest member, Ms. Krupp. And I think we are adjourned at 11:32 a.m. Thank you. Everybody stay healthy.